Congenital tracheoesophageal fistula. It is a congenital abnormal connection between the esophagus and the trachea. It is also known as TE fistula or simply TEF. It often occurs with congenital esophageal atresia. With esophageal atresia without connection with the stomach, the swallowed fluids and milk cannot be digested. The swallowed fluids can pass through the tracheoesophageal fistula to the lungs, leading to respiratory problems. The incidence 1 to 4,000 births, with 30% premature. Normal development. The trachea and the esophagus begin developing at one single tube. At about 4 to 8 weeks after conception, a septum forms between the esophagus and trachea to separate them. If this septum doesn't form properly, tracheoesophageal fistula and or esophageal atresia can occur. Division of the cranial part of the foregut just caudal to the primitive pharynx to the trachea anterior and esophagus posterior. The development of the trachea and the esophagus. The esophagus is initially short. It elongates with growth and descent of the heart and lungs. It is temporarily obliterated by the proliferation of the epithelium. Recanalization occurs by the end of the embryonic period. Abnormal development. Esophageal atresia without fistula. Esophageal atresia with proximal tracheoesophageal fistula. Esophageal atresia with distal tracheoesophageal fistula. Esophageal atresia with proximal and distal tracheoesophageal fistula. No atresia with H-shaped tracheoesophageal fistula. Other associated anomalies may be Trisomy 13, 18, or 21, other digestive tract problems, diaphragmatic hernia, duodenal atresia, or imperforate anus. Heart problems, ventricular septal defect, tetralogy of Fallot, or patent ductus arteriosus. Kidney and urinary tract problems, horseshoe or polycystic kidney, absent kidney, or hypospadias. Muscular or skeletal problems, Vertebral syndrome, vertebral, anal, cardiac, tracheoesophageal fistula, renal, and limb abnormalities. Up to half of all babies with tracheoesophageal fistula or esophageal atresia have another congenital anomalies. Diagnosis. Clinical examination including the medical history, imaging studies to detect tracheoesophageal fistula and or esophageal atresia, X-ray chest and abdomen. Transoral or trans-nasal insertion of a small tube into the esophagus to detect the atresia. The tube's position in the esophagus can also be seen with the X-ray. Treatment. Surgery is essential for treatment of tracheoesophageal fistula or esophageal atresia. Repair of the atresia, excision of the fistula with good repair of the trachea and esophagus. Sometimes esophageal atresia requires staged surgical sessions. Post-operative problems. Some children born with esophageal atresia have long-term problems, difficult swallowing due to peristaltic problems, uh, uh, partial block of the bolus due to the esophageal scarring. Esophageal stenosis. About half of the children who had been repaired for esophageal atresia will have gastrointestinal reflux disease, GERD. Good luck and best wishes.